Good afternoon or good morning, everyone, depending on where you're located. Thank you for joining the HOME-ARP Documenting Qualifying Populations webinar today. Now that we've covered logistics, let's do quick introductions of presenters. Next slide, please. So my name is Lucas Johnson, and I'm with ICF. I'm joined today by my colleague Judy Perlman, who is co-presenting. We're also joined by Elisa Hupp and Stephanie Carl from ICF. They'll be monitoring the Q&A box, as Kate mentioned, and answering questions posed in that Q&A box directly today. Next slide, please. So now I'd like to briefly go over the agenda. We'll start by sharing a brief overview of topics to be discussed throughout the presentation. The goal of this webinar is to help PJs understand HUD record keeping and documentation requirements for determining qualifying population eligibility and demonstrating compliance with those requirements to HUD. HOME-ARP funds must primarily benefit individuals and families in one of the four qualifying populations. We'll review definitions for each qualifying population, along with the key documentation components, and review case scenarios throughout the presentation today. We'll also discuss additional documentation requirements pertaining to the specific HOME-ARP activities as outlined in Section 8F of the HOME-ARP notice. Lastly, we'll provide a brief overview of common preferences and methods of prioritization, followed by a summary of topics that we discussed, leaving time to respond to questions posed in the Q&A box at the end, if time permits. So please note, qualifying populations are abbreviated as QPs throughout this webinar and in various HOME-ARP materials. So now I'll turn the presentation over to Judy, who will begin with an overview of qualifying populations. Next slide, please.
Thanks so much, Lucas. Hello, everybody. HOME-ARP funds are intended primarily to benefit four qualifying populations, which is the subject of today's session. This assistance comes through four major activities: developing rental housing, creating non-congregate shelter, providing supportive services, and/or providing tenant-based rental assistance. This webinar is intended for PJs and their partners who will decide about each household's eligibility for HOME-ARP. First, by determining that they meet the requirements for one of the four QPs, and then by documenting that eligibility fully and completely. I will lay out some basic requirements for determining and documenting eligibility. Lucas will then lead us into discussing the specifics for each qualifying population and will provide instructions and examples for documenting that households meet each QP-specific set of criteria. Finally, we'll discuss and provide examples of ways to document preferences and limitations at the PJ level. Next slide, please. Here then are the four QPs. QP1 is for households that are homeless. QP2 is for households at risk of homelessness. QP households are experiencing domestic violence, dating violence, sexual assault, stalking, or human trafficking. And QP4 includes other populations. There are a few general considerations that we want to just kind of put out to frame our conversation regarding QP documentation. First of all, QP definitions are specific to the HOME-ARP program. While you can lean on processes you may have in place for documenting eligibility under other HUD programs, for example, HOME, COC, or ESG, please know that these policies and forms will not automatically work for HOME-ARP. That's because the HOME-ARP definitions are unique to HOME-ARP, and we'll hear more about that as the day progresses. Secondly, QP definitions primarily focus on living situations for the households. This is a key difference from the HOME program, which focuses on the income level of the household. Finally, while income level is included in some QP definitions, it's not included in all. That means that some households will be eligible for HOME-ARP assistance regardless of their income level. Today, our focus is on the first step that needs to happen: determining a household's eligibility for HOME-ARP. Subsequently, after that household has been found eligible, Households that are seeking financial assistance for rent will be asked about their income, regardless of their QP, in order to set their rent levels. But for today, our focus is entirely on that first assessment for eligibility under one or another QP and gathering the documentation that supports that determination of eligibility. We encourage PJs to review their HUD-accepted HOME-ARP allocation plans to identify the qualifying populations that they plan to assist. If your allocation plan includes preferences or limitations, staff involved in those projects will likely be documenting those QPs or subpopulations more often than the other QPs, although the notice does require that members of all QPs have access to some HOME-ARP resources in every community. If your allocation plan includes no preferences, then folks in your community should be prepared to document all 4 qualifying populations. There's a very useful handout called HOME-ARP Qualifying Populations at a Glance. It should have been sent to you along with your registration for this. And Kate, if you wouldn't mind popping it into the chat right now, that would be really great. It's also posted on the HUD Exchange. This document, this tool, is a handy lookup chart that outlines the definitions for the different qualifying populations. We recommend that you'll be using this a lot, and so you may either want to print it out or create a bookmark for it as you and your staff and your partners move into the actual activity of determining eligibility. Next slide, please. So section 8 of the HOME-ARP notice starts on page 75. This section focuses on program administration. It contains lots of useful and valuable content, which will be useful to you during this time of program planning, launch, and implementation. For today, most of our focus is on item F, record keeping, which starts on page 86. Record keeping tells us what we need to know about how to document qualifying population eligibility. It's worth taking a minute to ask, why is record keeping for QP eligibility so very important? The fact is that compliance is achieved and demonstrated through documentation. To be in compliance, PJs must ensure that their subrecipients are serving members of eligible QP categories. Record keeping demonstrates that QPs are assisted and specifies which QPs are assisted. However, we want to just take a minute to point out that other parts of Section 8 will provide very important details on how to administer your HOME-ARP program. As a PJ, and specifically if you are relatively new to administering federal funding, Section 8 will be a great tool for you into your responsibilities and how to set things up properly. Here are a quick few takeaways from Section 8. Parts A and B note that a PJ is responsible for managing the day-to-day operations of its HOME-ARP program, ensuring that HOME-ARP funds are used in accordance with all program requirements, and these are embodied in written agreements, and taking appropriate action when performance problems arise. Working with state recipients, subrecipients, or contractors does not relieve the PJ of this essential responsibility for overall oversight. PJs are also responsible for establishing and maintaining sufficient HOME-ARP program and project records, financial records, program administration records, records concerning federal requirements, as well as working with state recipients and subrecipients. This is all in Section 8, Part F. Part F also includes details on the period of record retention and access to records. Section 8, Part H has important guidance concerning confidentiality. PJ staff should already be thinking about confidentiality and protection of the personal identifiable information for all HOME-ARP supported households. It's spelled out in Part H, and there is further information surrounding confidentiality for members of QP3 that you if you're working with QP3, you want to make sure you're very closely looking at Part H. With this level of detail, PJs and their partners will do well to read the notice closely and use the tools and guidance found on the HUD Exchange to really learn the ins and outs of HOME-ARP implementation. A last note is that Section 8 is not the only place in the notice that addresses documentation and record-keeping requirements. We've incorporated all relevant requirements as they are applicable into this presentation, but as you read through the whole document, you'll find, through the whole notice, you'll find other things as well. Next slide, please. Okay, now we're going to dig into the hows and whys of assembling documents that accurately and completely establish a household's eligibility for one of HOME-ARP's qualifying populations. After that, we'll drill down into documentation for each of the specific QPs. Next slide, please. We spoke earlier about record keeping, about how important record keeping is for qualifying populations' eligibility, since compliance is determined and verified through that documentation. As a PJ, remember that you have the ultimate responsibility to HUD to make sure this is being done accurately and completely. PJ and subrecipient record keeping, confidentiality practices, and policies and procedures must all be updated for HOME-ARP. As we said before, that many things differ from the other programs you may have been working in previous years. Written agreements are also another place where that must include all record-keeping requirements and related elements as well. Again, why does this matter? If subrecipients aren't serving eligible QPs, then HOME-ARP funding is put at risk, potentially requiring repayment. Without documentation, the subrecipient and PJ have no way to demonstrate that QPs actually were assisted and that the people who were assisted are members of the qualifying populations. Record keeping is a necessary part of complete and accurate compliance. If case files are incomplete, it can raise questions about the PJ's overall management capacity. And finally, complete records also undergird the accuracy of data on the households who are served. Client records and client data need to be in alignment. And as put here in this best practice box, it's really important that all of these requirements and expectations are embodied in every written agreement that PJ enters into. PJs and HUD will monitor subrecipients and their records to ensure that QP eligibility is sufficiently documented. We encourage you as a PJ not to assume that the contractor, owner, or subrecipient is maintaining records that meet HOME-ARP requirements. Rather, we really recommend that as the PJ, you provide ample training and ongoing technical support to your subrecipients, as well as frequently monitoring case files. We further recommend that you monitor them in partnership with program staff to build their capacity and their ability to ensure that this documentation is being carried out in compliance with HUD, requirements. Sorry about that. QP documentation is no doubt challenging, and it requires more than completing a simple income determination. HOME-ARP documentation can get quite convoluted. For example, for QP2 and QP4, what's required is not only documentation about a household's living situation, but also income is required. And for one subgroup within QP4, rent information also needs to be gathered and included in the case file in terms of determining eligibility. Given the complexity of this, it's useful to contract with subrecipients for certain activities, such as HOME-ARP coordinated entry, that are already skilled in documenting eligibility. This is something to take into consideration as you're building your local HOME-ARP program and preparing for implementation. Next slide, please. Now let's discuss general record keeping at the project level. Understand that preferences and limitations require the collection of additional documentation in order to support that preference or limitation. For example, an activity with a QP1 preference for chronically homeless households requires documentation that these QP members who meet that preference also meet chronic homelessness criteria and requirements. Secondly, you've got to make sure that your policies and procedures will ensure confidentiality. Put in place record-keeping processes that ensure confidentiality for all QPs and be very thoughtful about special considerations for QP3. These record-keeping practices may include keeping only minimum required documentation in the file. So think about the confidentiality and what's required in the file quite carefully. Lastly, when building your policies and procedures and detailing any methods of prioritization, be sure to identify who it is that's responsible for collecting documentation. At one level, remember again that even if subrecipients are carrying out HOME-ARP activities, including eligibility determination, ultimately the PJ has responsibility to HUD to make sure this is complete and accurate. The project level referral method identifies the entities that are responsible for collecting QP documentation. So for example, if you're using a coordinated entry system exclusively, likely it will be staff at the coordinated entry operator who would be collecting that information. But in the case of coordinated entry with other referral methods, it can be quite complicated looking at different projects and different programs to determine whose responsibility it is to collect and retain that information. So be sure that you've thought through with giving careful consideration, not only on your entire portfolio, but for individual projects or programs. Outline those responsibilities clearly and make sure that they are written in your written agreements and appear in your policies and procedures. One last thought. Record keeping for QP eligibility is really important as, again, compliance is determined and verified through documentation. I think I've said this at least twice already today, but Lucas and I are going to keep repeating this throughout the presentation because it's that important. Insufficient documentation regarding QP eligibility means that HOME-ARP funds are at risk, potentially requiring repayment, and it may also mean that your investments are not reaching the populations that HUD wanted to reach with this program. Next slide, please. Now we're going to take a few minutes to talk about the preferred order within this documentation. This preferred order of documents must be followed for QP 1 and 2 and 4. This preferred order of documents does not apply to QP 3. We will be definitely providing examples as we move forward. We're just going to go through this at sort of a high level right now. As a note about QP3, QP3 does not follow a preferred order. PJs and subrecipients should collect only minimal information on QP3 members. This is part of the confidentiality necessary for this QP. We'll go into this later in the presentation and give examples of documentation as we go through case scenarios. For now, let's go back to QPs 1, 2, and 4. PJ's policies and procedures must establish the order of priority for obtaining evidence as follows. Third-party documentation first. Second tier is intake worker observations. And then at the third level, certification from the person seeking assistance. We'll dig into this now. However, an important point as we go into this conversation, the lack of third-party documentation must not prevent a household from being immediately admitted to emergency shelter, receiving street outreach services, or being immediately admitted to shelter or receiving services provided by a victim services provider. It's more important to get people into services than to insist that their case file is filled with third-party verifications. And just as a note, these record-keeping requirements for HOME-ARP are adopted from the Emergency Solutions Grant Program, 24 CFR 576.500, Section B. Next slide, please. General record keeping related to third-party verification. First-tier documentation. These are records that come from a third-party provider directly to the intake staff to put on file. This can include source documentation like an SSI award letter, an eviction notice or other court order, or discharge paperwork from a healthcare facility. These are third-party communications. Another form of third-party includes written verification. In this case, this could include written observation of a shopkeeper, a written referral from law enforcement, or a letter from a property owner stating that the person must vacate their housing. If this is the level of verification that you're using, this must be written, signed, dated, and submitted on appropriate letterhead by the intake worker that to embody these written observations that are written after conversations or that are received as communications. Lastly, documenting oral verification is a form of third-party verification. This is verification that's provided by a third party directly to intake staff verbally. Intake staff record the statement in writing, certify that the statement is true and complete, and sign and date that statement. An example of this would be an intake worker calling a leaseholder who confirms that an individual or family can no longer stay in that apartment after this week because of pending lease violations. These three types of documents are the most highly preferred forms of documentation for QP eligibility. An attempt should be made to obtain third-party verification before any other type of documentation. Next slide, please. Second-tier documentation then is intake worker observation. If no third-party verifications are available, written documents or oral verifications can be obtained at intake. At that point, or following that, an intake worker will document their attempts to obtain third-party verification, the outcome of their attempts, and any barriers that they encountered in those efforts. At that point, intake workers can provide written observations where appropriate. Intake observations are not always appropriate or relevant. An intake worker can't, for example, observe someone's income level. But when the intake worker's observations are relevant and they have to do with things like living situation, they should, again, be issued on third-party letterhead or from on agency email. Identify the intake worker that made the observation, certify that the statement is true and complete, and be signed and dated by the intake worker. An example is an intake worker physically observes a person residing in their car and writes, signs, and dates that observation for the record. The circumstances under which an intake worker's observations can be accepted, what the intake worker's observations need to include, including the items on this slide, all of this should be clearly defined within the PJ's HOME-ARP policies and procedures. Next slide, please. If no source documents, written documents, or oral verifications can be obtained, then an intake worker can document their varied attempts to obtain such information document the outcomes of those attempts and any barriers that they faced in trying to obtain first tier or third tier or second tier documentation. If an intake worker's observations are not able to verify the status, as a last resort, self-certification can be used. Self-certification must identify the individual or head of household, provide detail of the specific criteria being documented, certify that the statement is true and complete, and be signed and dated by the individual or head of household. Self-certifications really should be used as a last resort and used rarely. The circumstances under which a self-certification can be accepted and what the self-certification needs to include, including the items on this slide, should be clearly defined in the PJ's policies and procedures. Next slide, please. Okay, here are some general tips focused on QP documentation. Use multiple sources or data, use multiple methods or data sources. Sometimes multiple pieces of documentation are really needed to sufficiently document QP eligibility. Know that and go ahead and use multiple methods to make sure that you have sufficient documentation. Second, use a client-centered and client-focused approach. Don't require things that cannot be provided. Often, client circumstances dictate what documentation can or can't be gathered. You may need to ask the client what they are able to provide in order to demonstrate their current housing crisis or other living situation. Think of it as working alongside the client in order to sufficiently document their QP status. Remember then, finally, that self-certifications, though allowed, should be used infrequently. And also consider what additional documentation is available to support that self-certification in order to try to bolster the level of documentation that you have. Next slide, please. Throughout the next part of this presentation, we'll be discussing the process to appropriately document each QP. The documentation differs between the QPs, but the overall process is the same and is shown on this slide. So to determine what documentation is needed, you'll start by describing the household's living situation, including their primary nighttime residence and the elements of their housing crisis. That will help you guide the determination of which QP they qualify, under which QP they qualify. Then you go and you find the specific regulation which tells you what is the specific and acceptable documentation in order to document this eligibility. You then think about that preferred order going from third party to intake worker to self-certification, and you focus on that, and you then go ahead and you review documents and assemble them to make sure they're describing the essential pieces of that QP definition for this specific household. It's a good idea for the PJ or the subrecipient working with the PJ to develop a formal checklist to standardize intake practices and QP eligibility determination activities. There's another document that was sent to you via email prior to today's session. This one is called HOME-ARP QP documentation requirements. And Kate, if you would be so good as to drop it in there, that'd be great. Thank you. It's also posted on the HUD Exchange. This document is a longer document and it has more information in it that you can use in this documentation process. It describes the living, for each QP, it describes the living situations, the order of priority, and examples of documentation that will be acceptable. It's a great document as you're building your policies and procedures and templates for case file organization as you implement your HOME-ARP programs. Okay, now I'm going to turn things over to Lucas, who is going to begin reviewing documentation requirements for the specific qualifying populations.
Thank you, Judy, for that overview. Next slide, please. So now we'll discuss the different documentation requirements for each qualifying populations, starting with QP1. Each qualifying population section will include a definition summary and outline key components for each paragraph within those definitions. Next slide, please. So the notice definition for QP1 refers to 24 CFR 91.5, homeless, paragraphs 1, 2, and 3. So it's important to note here that paragraphs 4, category 4 of the homeless definition, individuals and households fleeing domestic violence, is not included under the HOME-ARP homeless definition. So now that we've done that brief summary, let's review each paragraph under QP1 in greater detail. Next slide, please. So QP1, paragraph 1, describes someone who is literally homeless. That includes an individual or family who lacks a fixed, regular, and adequate nighttime residence, meaning their primary nighttime residence is a public or private place not designated for regular sleeping accommodations, or they are living in a supervised publicly or privately operated shelter designed to provide temporary living arrangements, and that includes hotels or motels paid for by charitable or governmental organizations. This also includes those who are exiting an institution where they've resided for 90 days or less and resided in an emergency shelter or a place not meant for human habitation immediately prior to entering that institution. Next slide, please. The key components of the definition for QP1, paragraph 1, focus on where an individual is living. When collecting documentation for literally homeless households, PJs must verify that the household is experiencing one of the living situations outlined here, which I just mentioned. So please note for QP1, paragraph 1, there's no income document component here. So some definitions, like Judy was mentioning, do have income requirement components, but QP1 does not. Next slide, please. QP1, paragraph 2, is referred to under COC and ESG as being an imminent risk of homelessness. So this definition includes an individual or family who will lose their primary nighttime residence within 14 days of the date of the application for assistance, and no subsequent residence has been identified, and that household lacks resources or support networks needed to obtain housing. Next slide, please. So key components for QP1, paragraph 2, focus on the household's housing crisis. So documentation will need to detail the timeline, indicating the household has 14 or fewer days from losing their current residence, and that they lack resources necessary to obtain other housing, and no other housing residence has been identified for them. So similar to QP1, paragraph 1, there's no income requirement here. It's important to remember when collecting documentation for households that are at imminent risk of homelessness, PJs must verify all 3 of these conditions, making sure they're met as outlined in the definition. And those, the handout that we shared in the chat earlier, the QP documentation requirement, provides examples of source documentation for each of these conditions. Next slide, please. Lastly, for QP1, we'll discuss individuals and households under QP1, paragraph 3, referred to as homeless under other federal statutes. This includes unaccompanied youth under 25 years of age, or families with children or youth who do not otherwise qualify as homeless under the QP1 definition, but who are defined as homeless under one of the other listed federal statutes under section 4A1 of the HOME-ARP notice. And in these situations, they must have not had a lease, ownership interest, occupancy agreement in permanent housing in the last 60 days immediately prior to the date of application for assistance, and they have experienced persistent instability as measured by 2 or more moves in the last 60 days, and they can be expected to continue in such a status for a prolonged period of time due to special needs or barriers. And some barrier examples that are listed here may include chronic health or mental health conditions, substance addiction, or a history of domestic violence or child abuse. Excuse me. Next slide, please. Regarding the key components for QP1, paragraph 3, like we covered, and which is important to every QP, we're looking at the history of the individual or the family's living situation. So as we just discussed, to meet the definition of QP1, paragraph 3, they must have had no permanent housing within the last 60 days, and they've had to move 2 or more times, and there's a presence of the special needs or the 2 or more barriers, which we just discussed. So when collecting documentation for households as homeless under other federal regulations, PJs must verify that all of these conditions are outlined in the definition. So for this population, you're not collecting income documentation as part of the eligibility documentation process. And it's important to note that under section AF2H of the HOME-ARP notice, households under this definition must not be required to provide third-party documentation to show they're homeless, to receive any shelter, housing, or services for which ESG or COC program funds may be used to supplement HOME-ARP assistance. However, PJ should attempt to seek documentation to support self-certification regarding at least 2 moves in the last 60 days. So those attempts must be documented. Next slide, please. So now that we've reviewed each paragraph under the QP1 definition, let's move on to a case scenario to put what we've learned into practice. In this scenario, a participant states that he is homeless because he's currently residing in a tent in a local park. So you request documentation to verify the participant's current living situation from HMIS and local shelters. The client has an HMIS entry indicating they've been staying at an emergency shelter for the past week, and the shelter provides a letter indicating the client is residing in their shelter. Next slide, please. So in this situation, this individual would qualify under QP1, paragraph 1. Again, under 24 CFR 91.5, paragraph 1, that will describe the acceptable order of priority for obtaining necessary evidence of their QP status. So the key component here is the individual's living situation. And in this scenario, the participant states that they're currently residing in an emergency shelter. And it's very important for PJs to establish policies and procedures that outline that third documentation is first priority, intake worker observation is second priority, and self-certification is the third priority, which Judy mentioned earlier. In this case, you've obtained a letter from the client. You've obtained a letter supporting the client's claim that they're residing in the emergency shelter program. So that's considered first priority, which is third-party documentation. So in addition to the notice, you as a PJ must follow the requirements of 24 CFR 576.500B, 1, 2, 3, or 4 as applicable. And these are the regulations. These regulations are the record keeping and recording requirements for the Emergency Solutions Grant, or ESG. And that section B discusses how to document homeless status based on how a person is experiencing homelessness. And in the HOME-ARP notice, under section A, 8F2H, that refers to 24 CFR 576B, which I just mentioned, that explicitly states the acceptable evidence of homelessness based on that QP1 definition for that qualifying household. So we covered a lot there. In summary, PJs must collect acceptable evidence of homelessness. They must maintain and follow written intake procedures, document QP status at intake to establish and verify an individual or family's homeless status, and collect documents in the preferred order established by HUD, which are, I know we're going to say this a lot, once again, that's third-party documentation, followed by intake worker observation, followed by self-certification. Next slide, please. So now we'll cover qualifying population 2, which is at risk of homelessness. Next slide. QP2 is defined in notice section 4A2. It refers to 24 CFR 91.5 at risk of homelessness, which includes 3 paragraphs. And those are individuals and families, unaccompanied children and youth, and families with children and youth. So in the following slides, we'll walk through each paragraph in greater detail. Next slide, please. So QP2 paragraph 1 includes individuals and families who have an income below 30% area median income, also referred to as AMI, and they do not have sufficient resources or support networks immediately available to prevent them from moving into an emergency shelter or another place defined in the literally homeless definition. And they'd meet one of the 7 conditions, which we'll cover on the next slide, which we can jump over to now. So the evidence of housing instability includes A, an individual that has moved because of economic reasons 2 or more times in the last 60 days, immediately preceding the application for homelessness prevention assistance. B, is living in the home of another because of economic hardship. C, has been notified in writing that their right to occupy their current housing or living situation will be terminated within 21 days of the application for assistance. D, they are living in a hotel or a motel, and the cost of the hotel and motel stay is not paid for by a charitable organization or by federal, state, or local government programs for low-income individuals. So E is they live in a single family room occupancy or an efficiency apartment unit in which there reside 2 or more persons, where there reside more than 2 persons, or they're living in a larger housing unit in which there reside more than 1.5 people per room. F, they're exiting a publicly funded institution or system of care. Or G, otherwise living in a housing that has characteristics associated with instability and an increased risk of homelessness as identified in your approved consolidation plan. Next slide, please. When looking at the key components of QP2, paragraph 1, you can see here that income is a requirement under this definition. So you'll need to specifically think about how to obtain documentation that shows the household is receiving less than 30% AMI. You'll also need to obtain documentation describing a lack of resources and support and evidence of one of the conditions of housing instability, which we just went over. Next slide, please. Under QP2, paragraph 2, defined as a child or youth who does not qualify as homeless under the definition, but qualifies as homeless under other federal statutes. QP2, paragraph 3, is a child who does not qualify as homeless under the homeless definition, but who qualifies as homeless under section 725(2) of the McKinney-Vento Homeless Assistance Act, and the parents or guardians of the youth if they're living with her or him. Next slide, please. So to go over the key components for QP2, paragraph 2 and 3, they share the key components here. Documentation should support that the household meets the definition of homeless under other federal statutes, and we need that documentation of the child or youth's age. This includes, again, parents and guardians living with a child who qualify under paragraph 3. So for this population, please note there is that income requirement documentation for this population. So next slide, please. So let's run through another scenario here. In this scenario, a HOME-ARP applicant is being evicted from their apartment in 18 days. They state they lost their job and they're receiving unemployment benefits, and they also have no other immediate available resources. Next slide, please. So this household meets the key components of QP2, paragraph 1. In this instance, the PJ would follow the appropriate process to obtain documents to support this QP status, gathering documentation on income, a lack of resources, and that they meet one of those conditions, A through G, which we went over. In this case, we could collect third-party documentation such as their unemployment letter, a bank statement to show lack of resources, and an eviction notice showing they've been notified in writing that the right to occupy their current housing or living situation will be terminated within 21 days. And in this situation, they have 18 days, so they do meet that requirement. And it's important to note under HOME-ARP Notice Section 8F2I, which refers to 24 CFR 576.500C, 1 or 2 is applicable. That demonstrates what records or that describes which records demonstrate that the household is at risk of homelessness and qualifies under QP2. So a quick overview, PJs must complete the intake and certification forms that meet HUD specifications for every qualifying household receiving HOME-ARP assistance, including an income certification. PJs must also collect documentation to establish and verify their at-risk of homelessness status and collect documentation according to the preferred order as outlined in the notice, in which we've discussed several times throughout this presentation. And that at-risk of homeless status may include certification by a local nonprofit organization or a state and local government entity would be responsible for administering that assistance under listed federal statutes. So now I'll turn the presentation back over to Judy, who will share documentation requirements for qualifying population 3 and 4. Next slide, please.
Great, thanks so much, Lucas. And let's just dive right in. Next slide, please. The summary definition for QP3, defined in the notice section 4A3, includes households that are any individual or family who is fleeing or attempting to flee domestic violence, dating violence, sexual assault, stalking, or human trafficking, which includes labor or sex trafficking. The definition found on page 6 of the notice goes on to refer to cases where an individual or family reasonably believes that there is a threat of imminent harm from further violence, and further identifies circumstances which, quote, cause the individual or family to be afraid to return to or remain in the same dwelling unit. Next slide, please. Well, this slide provides citations for all of these regulations that are used in this QP definition. You will receive this slide deck if you haven't downloaded it yet. So if you're interested, you can get back in here and look up all of these at your own convenience. For now, we'll just assume that we're working under the same set of understandings. Next slide, please. Now we're looking at the key components for QP3. Earlier, I mentioned, and we've both been mentioning, Lucas and I, that some QP eligibility won't involve income documentation. QP3 does not have any income requirement. Eligibility is based on the household's circumstances, not their income, not their housing status, or their homelessness status. Also included in the definition is that the individual or family would need to be under the threat of harm based on their current living situation. Next slide, please. So here in this case scenario, a HOME-ARP applicant states that he and his daughter are at imminent risk of harm due to a domestic violence situation at their apartment. Next slide, please. So pulling this apart a bit, they are housed. There is an imminent risk of harm at their current residence due to domestic violence. And so this household will qualify as a member of QP3. Under QP3, you remember, there is no preferred order of priority for the documentation. Only minimal information should be collected, and you should definitely be keeping confidentiality top of mind with these households. The documentation in this case could be the intake worker writing an oral statement from the head of household that they are attempting to flee from domestic violence where there is an imminent risk of harm and they fear returning to that household, to that apartment. Next slide, please. Qualifying population 4, other populations. Let's review these documentation requirements now. Next slide, please. Under the summary definition for QP4, which is defined in the notice in section 4A4, we have 2 paragraphs here. Paragraph 1 refers, and this is paraphrasing a little bit, other populations where providing supportive services or assistance would prevent the family's homelessness or would serve those with the greatest risk of housing instability. Actually, that's just for all of the, sorry, that's for all of QP4. This population includes individuals and households who do not qualify under any of the other populations above, but meet one of the following criteria. And now here we go into the specific paragraphs. I apologize. Paragraph 1 includes other families requiring services or housing assistance to prevent homelessness. And paragraph 2 has 2 sections: at greatest risk of housing instability. And 2 groups fall under here. One is those who are extremely low income and have a severe cost burden on them due to their rent level. And the paragraph 2II is low income households who are at risk of homelessness. So let's take this paragraph by paragraph. Next slide, please. QP4 paragraph 1. It's specific to individuals and households where supportive services are needed to prevent a recurrence of homelessness. That's because these households all were previously homeless, and they are currently housed due to temporary or emergency assistance that is ending. And there is a need for additional assistance to prevent the household's return to homelessness. People who are qualified as QP4 under this paragraph need to have met all 3 of these criteria. Next slide, please. Here again, we see the QP4 paragraph 1 includes those 3 elements: the homeless history, they're currently living in time-limited assistance, and additional assistance is needed to prevent that return to homelessness. Here we see QP4 paragraph 1 has no income requirement. Let's go on now to paragraph 2. Thank you. Next slide, please. Paragraph 2 refers to households at greatest risk of housing instability, and paragraph 2I then focuses on households whose annual income is less than or equal to 30% of area median income, and the household is experiencing a severe cost burden, or in other words, is paying more than 50% of their monthly household income towards their housing costs. So that's paragraph 2I. Paragraph 2II reads, the household has an annual income that is less than or equal to 50% of area median income, and they show evidence of the housing instability examples tied to the specific conditions under the at-risk of homelessness definition. That's what Lucas just did a few minutes ago, so we're not going to read through them again, although they appear on the next slide. So let's look at the next slide, please. I will say that this list exists in the notice both under QP2 and QP4. So if you're putting together one of those checklists, you'll find it in both of those places. Next slide, please. So the key components of QP4 paragraph 2. Let's start with paragraph 2I. You need to have evidence that the household's income is at or below 30% of area median income, and you have to have evidence that they are paying more than 50% of their annual income toward the housing costs. So here we see that income is a requirement to meet paragraph 2I. Paragraph 2II then is slightly different. These are households with income up to 50% of area median income, and they are able, you are able, or with them, you are able to document their housing instability, meeting one of those conditions, A through G, from the at-risk of homelessness list. And here too, we have an income requirement. Next slide, please. So here's our case scenario. A HOME-ARP applicant is on SSI and is falling behind in their rent. Rental costs are rental unit costs are $500 a month, and this constitutes nearly 70% of their monthly income. Next slide, please. The 2 key elements of qualifying as a member of QP4 under paragraph 2 includes their income now we're looking specifically at paragraph 2I, includes their income and their cost burden. So in this case, the household is living in housing where they're paying most of their income for rent, and they are low income. So the key components that you're going to be looking at is what is their income level and what is the relationship between their income and their rent. To document being cost burdened, a copy of the lease agreement with the rental amount should be submitted and or retained in a file according to the PJ's policies and procedures. The staff member can then do a simple calculation of the percent of income from SSI versus the housing cost. This will show that more than 70% of their income, their monthly income, goes towards the rent and that they are cost burdened. So there are those two key pieces of documentation. Now I'll turn the presentation back over to Lucas, who will take us through record keeping for preferences and methods of prioritization.
Great. Next slide, please. Thank you, Judy. So now that we've covered the documentation requirements for the different qualifying populations, let's briefly discuss preferences and methods of prioritization and their impact on record keeping and documentation. In addition to the documentation needed for QP status through the HOME-ARP program, which is required for every activity, PJs may also require specific projects or activities with preferences and methods of prioritization to collect additional documents for that. So this is especially true with identifying subpopulations under preferences or using a method of prioritization that's different than the chronological order of receipt. Next slide, please. So let's review the steps for documenting preferences and the method of prioritization. PJs will first need to clearly identify the preference and the method of prioritization, which must be documented in their allocation plan. So for subpopulations of QPs, the PJ needs to clearly define who's included in the subpopulations. For instance, PJ should consider if they're using an existing regulation definition of a subpopulation. Alternatively, is there a local definition that you will follow? Did you clearly define the preference in your allocation plan with enough detail to document what you meant by that preference or that method of prioritization? So the next step would be to pull out the key components of the preference for documentation efforts and identify the key pieces of the definition where documentation efforts should be focused. So these are the key indicators you'll need to show that an individual or a household meets that definition. And lastly, step 3 will be to determine what types of document support the key elements of the preference definition, and if you have any preferred order that will be required for obtaining those documents. So PJs really need to think about what types of source documents are already available, and who or what is observable through intake, and what are the minimum requirements necessary to provide that documentation. Next slide, please. So let's review a preference example briefly. In this example, we'll discuss a case where a PJ includes a preference for veterans under QP1. So after ensuring the household meets the QP1 definition, you'll need to think about what documentation is needed for veteran status. So PJs, you'll need to define what you mean by veteran. Are you planning to use a federal definition or a local definition? Many veterans organizations define veteran differently based on criteria like discharge status, length of duty, length of active duty, or period of service. So you'll want to get that definition down. And in this example, the PJ will need to determine what the acceptable options are, such as a DD-214 or a veteran ID, or a printout of a veteran service records, maybe a confirmation of a veteran status in squares, or a letter obtained from the VA or another veteran service providers. And as a reminder, PJs should outline definitions and the acceptable documentation for these preferences. Please outline them in all the 3 places listed here on this slide, in your written agreement, in your tenant and client selection plans, and in your policies and procedures. Next slide, please. So in this next example, we'll look at a method of prioritization, which is the length of time homeless. So in every instance, you'll need to document the QP, household's QP status, which we've reviewed through all the various qualifying populations. After ensuring they meet the definition of a qualifying population, you'll need to determine what documentation is needed for that method of prioritization for length of time homeless for, this is QP1 for this example. So again, what do you mean by your definition here? And in this situation, what do you mean by the length of homelessness? Is that measured in days, months, or years? And does that include all of the months in someone's life? Are you looking at the last 3 years? Or specifically, are you looking in this current episode? So make sure you're explicit in your definition so it's measurable and that there's a way to document what you mean by that definition. And some documentation options may include partnering with homeless services providers as much as possible. And PJs must follow that preferred order of documentation. As a reminder, again, that's the preferred order goes third-party verification, intake worker observation, followed by self-certification. So when you're considering the use of self-certification, you'll want to determine how long of a period is acceptable for someone to self-certify. So these are all the decisions you're going to need to be thinking about here for your method of prioritization. So as a reminder, you'll need to document these definitions and acceptable documentation, again, in your written agreements, in your tenant selection plan, and in your policies and procedures. Next slide, please. So we've covered a lot today, and you've received the PowerPoint slides and the handouts, both in the message that was sent and in the links in the chat for how you're going to be determining or documenting QP status in your community. You may want to go back and review your allocation plan to identify preferences and methods of prioritization. As you're developing your policies and procedures, include that information again. I know we say this a lot, into your written agreements, into your tenant selection plans as well, and policies and procedures, making sure that everything is documented so it's clear what your expectations are for documentation. Next slide, please. So lastly, we want to cover some key takeaways for what we've covered today. So as a reminder, for qualifying population 3, the written documentation really only needs to include the minimum amount of information that indicates that the individual or the family meets that QP3 definition. You don't need to include any additional details about the conditions that prompted the individual or family to seek assistance, and really limit the inclusion of identifying information here, such as names in data entry and shared documents, until it's absolutely necessary. For instance, when a lease may be signed and you'll need that information. So PJs also, we want to remind you to consider staying low barrier and resist the urge to put the burden on participants to prove eligibility in situations where it's impossible to obtain third-party verification. Really consider being client-focused, thinking about what households are going through and why they're seeking this assistance. Be mindful about not putting undue burden on the households. PJ should really be thinking about partnering and using systems that you already have in place for that reliable documentation to assist in eligibility determinations after you've ensured that those systems and the information quality of those systems are acceptable. Next slide, please. We also wanted to discuss the creation of templates for your program. So we want to encourage PJs to create templates, drawing on current forms and procedures, documents, as well as new HOME-ARP tools, which may be tailored at the activity level to reflect your preferences and limitations. Those will come in handy not only for you, but you can also provide the subrecipient and owners with those templates to assist in documenting QP eligibility. And you'll also want to ensure that the definition differences between HOME-ARP and the other programs, that is clear. Lastly, regarding PJ oversight, we want to encourage PJs to clearly articulate in their HOME-ARP written agreements, the QPs that you're planning to assist include any preferences and limitations as outlined in your allocation plan and documentation standards. We also wanted to encourage providing training to ensure everyone understands what the requirements are when you're assessing for eligibility, and regularly review eligibility determinations to ensure that those are correct and that the implementation of preferences or limitations, again, as identified in your allocation plan, that those are correct as well. So we mentioned early on in the presentation that PJs are going to need to show documentation to prove compliance. So you may want to monitor often to make sure that everyone is documenting qualifying populations correctly. Next slide, please. And lastly, we'll go over the handouts which we've discussed, which are shared in the chat here. As mentioned earlier, the HOME-ARP qualifying populations at a glance handout is meant to provide PJs and their partners with definitions of qualifying populations. This document takes the technical QP definitions and it formats them in an easy, at a glance readability format. So the other handout that we share that's listed on the website is on the HUDX website for today's presentation. That's the HOME-ARP QP documentation requirements, which outlines the key components that we covered today for each QP definition that must be documented, and it provides example documentation for each component of those QP definitions. So lastly, there's also the HOME-ARP QP guide, and that provides a graphic visualization of summarized QP definitions. So we'll move on to our next and last slide here. So thank you for your attention during the presentation today. I know we covered a lot, so let's turn over. We have some time here to questions that you have in the Q&A chat. So as you can see, I think we already have a few questions here that have already been addressed, but let me put my microphone back on mute here real quick, and we'll go through some of those questions.
I see the most recent question was, are HOME-ARP QPs more strict than home requirements? And I can definitely see how it feels that way. I think the QP definitions are more involved. So there's a living situation component that is a part of what you need to document. So there's more things to document than the income requirements alone. So it's definitely different than what the requirements are for those who are eligible for home.
Thanks, Stephanie. Let's see. Will we?
So Judy and Lucas, hi everyone, this is Elisa. Thank you for presenting. We actually have not had many questions. So if folks have questions, I want to encourage you to put them in the chat box. At this point, we will try and answer verbally, or I'm sorry, put them in the Q&A box. We will try and answer them verbally rather than typing in an answer. But we did have one question about preferences versus limitations. And if PJ were to submit a substantial amendment to include either a preference or a limitation, what does that mean for other qualifying populations? We did provide an answer, but I wanted to just go back and reiterate that the difference between a preference and a limitation is that preferences mean you are still providing access to everyone, to all of the QPs. So you're still saying anyone who meets a QP definition can apply for our project or program. You can either refer yourself or you can go through a referral process, but you have access. Access meaning that you're able to apply. And then that project or program will implement that preference by moving whoever meets the preference definition to the top of the list and serving them first. So if in cases of a preference, all 4 qualifying populations have access, they're able to apply to the project or program, but that does not mean that all 4 qualifying populations will be served. In some cases, there will be projects or programs that have a preference, and those who meet the preference are the only ones who actually will receive services. But that is okay. That is still allowed. A limitation, on the other hand, is different in that it excludes access. So it prevents certain qualifying populations from even accessing the application. They're not allowed to apply or be referred to a project or program. An example of this, of when a limitation might be needed, is if you are creating emergency shelter for QP3, households who are fleeing domestic violence, sexual assault, and trafficking. In many cases, those types of shelters or programs who are serving QP3 households for privacy and safety purposes need to be limited from other QPs so that they can limit the number of people and the folks who are accessing the program and the project. So that would be an example of a limitation, and that would mean that QPs 1, 2, and 4 do not actually have access. They're not allowed to even apply to that shelter program or that project. So that's the difference between a limitation and a preference. We do have some resources on the HUD Exchange that I encourage you all to look at that go into detail about the differences between a preference and a limitation. Sorry, that was a long answer, but it's an important distinction that PJs really need to be aware of as you're thinking about who are we providing access to, what are the needs in our community, and do we need to do a substantial amendment?
Thank you, Lisa. And I saw a comment both in the chat and the Q&A about will the slides be available. Those were shared earlier by Kate, the slides for today's presentation. So if you scroll up in the chat box, you'll see the link there.
They also appear on the HUD Exchange. If you know somebody who wasn't able to be here, they can find them on the HUD Exchange as well.
So we got another question that we'll just ask out loud. So the question is from Alma, and it says that my local government has HUD HOME-ARP funding and Treasury Department ERA, Emergency Rental Assistance funding. We've been asked if HOME-ARP can provide supportive services to those ERA clients. I'm assuming, if I'm understanding the question correctly. So the answer is potentially, yeah, you may be able to provide rental assistance with the Treasury Department funds and then supportive services through HOME-ARP, but you need to be thoughtful about your program design in order to ensure that you're only providing supportive services to households who meet a HOME-ARP QP definition. So there is certainly crossover there between who qualifies for ERA funding and who qualifies for HOME-ARP funding, but it's not one size fits all. The definition, the eligibility criteria are different. So what I would recommend is as you think about program design and procedures and how you would implement this type of layered funding response, I would think about how you would determine if someone is going to qualify for HOME-ARP supportive services. If you're wanting to use the documentation that's already been collected for the Treasury Department funding, then you want to work with whoever's administering that funding and look at what documentation they're gathering and see if it meets the documentation criteria that's been laid out here today. You can use the handout on documentation requirements as a tool to do a comparison. And if it doesn't, and in some cases it might not, in many cases it might not, you need to make sure that as a PJ, you're instituting additional procedures that allow you to collect the required documentations to meet HOME-ARP QP criteria. Anyone want to add to that response?
I don't have anything to add. I think for this question and the other two questions in the chat, the answer is going to be it depends. So one was the ERA, and then we have two questions about preferences or limitations as well. based on fair housing law and whether or not they're applicable to fair housing law. And I think whenever you're looking at other funding sources, you have to compare and contrast who they're meant to serve and what are the eligible costs and how they align or don't align with HOME-ARP. And for preferences and limitations, we really encourage you to speak to the Fair Housing Division in your field office to have this conversation. And we don't say that because we don't want to answer your question. It's just a very nuanced topic that has a multi-pronged like legal analysis to it. And there's some things that if we just read it real quick, we'd be like, yeah, that's fine. But there might be another piece of it that, you know, it's not. And then, and conversely, there might be something that like we'd be like, absolutely not. And then there might be some nuance and loop like ways that it is acceptable, but we wouldn't be able to speak to that. So we highly encourage you to reach out and have those discussions.
Yeah, I agree. And reaching out to your field office is always, you know, for any of these kind of nuanced questions, that should always be your, you know, we want to encourage that to be your first point of contact. And then there is the homearp.gov mailbox, which goes to the Office of Affordable Housing Programs. And so you can also submit kind of more nuanced questions through that mailbox. And again, so just in regards to the questions, so we're not going to answer them specifically like Stephanie said, because they are a little bit nuanced, but I would encourage you to think, it's Nathan that's asking about elderly housing, so creating restrictions for elderly housing through HOME-ARP. And again, I want to kind of point back to, are you creating a limitation or are you creating a preference? They're two different terms that mean two very different things. And so you want to be very thoughtful about whether or not you're doing a preference or a limitation as you can move forward with your planning process.
One thing I just wanted to say in response to Monet's point that is it possible to get this webinar into other people's hands so that they can walk through this very granular analysis of the QPs? The answer is yes. There's a page that's all about, believe it or not, HOME-ARP qualifying populations and eligibility on the HUD Exchange. And once you find yourself there, there are these resources and the resources that we shared earlier. Another thing to think about, and we're hearing increasingly from communities where there's, you know, basically all staff are new to federal funds, new to this program and feeling kind of unmoored and things like that. It's also possible to request, it's not only possible, it's encouraged that you may want to request HUD technical assistance, which means that you basically have to sort of put out there in a form on the HUD Exchange what concerns you have, and then HUD takes it and thinks about if, you know, whether those are legitimate concerns, and then assigns you a team to help you work through those. And there's a lot of HUD support for the HOME-ARP program. So if you find yourself in that situation and you're trying to use these tools and resources and you're still feeling concerned and worried about it, it's always okay to reach out for HUD TA. And as Elisa just mentioned, to talk with your field office, because they are certainly working hard to be resources on HOME-ARP to all of their partners.
There was a comment in the chat box from Nancy, and it's kind of a comment question, but she said, how can we document that there's a need for additional assistance if we cannot verify current income? And I don't know when, like at what point in the presentation that came in. So I'm going to answer it in two ways. If you're asking about QP2, QP2 is at risk of homelessness, and it actually has an income requirement. So there are multiple parts. There are like three things, well, multiple ways that someone could meet the at risk of homelessness definition. But one of those ways is that they have an annual income below 30% AMI, that they also lack sufficient resources and support networks, and that they meet one of the following conditions that is outlined in the notice. So if you're asking about QP2, then you are in fact potentially using their income documentation along with other documentation to show that they don't have additional resources or support networks and would become literally homeless without assistance. But if you're asking in regards to the other QP definitions that do not have an income requirement, something I want to stress is that there isn't a needs assessment necessarily that's required to meet QP criteria, right? So if I would encourage you to reframe your question and think about what it is that you're trying to understand. Because if someone meets the QP definition and you can document that they meet the QP definition, even if that definition doesn't include an income requirement, then they've passed the needs test for whatever your project is. So there can be some nuance there. So if you're talking about supportive services, when you get into specific service types and service costs, you have to, look into whether or not the household needs that specific service. But that's an assessment for that individual service. And I don't want to go into that too much because we do have some training that will be coming out specifically around supportive services. But overall, as you're determining whether or not someone qualifies for a HOME-ARP project or program that you have, if they meet a QP definition, then they qualify. You don't have to do additional needs determinations to see whether or not they qualify for your program or project. Okay, so we're here for a couple more minutes, but I think if folks feel comfortable that they got the information that they need, we can wrap up. I want to thank you all for joining us today. We really appreciate it, and for joining us for all of the previous clinics and trainings that we've done. And we're looking forward to continuing to connect and work with you all.
All right, thanks everyone.
Thank you so much, everybody.